everyone. Today our class is about musculocutaneous nerve. Before starting the class, please share the video with your friends and classmates. Notes available in Instagram. Follow us in notes for Instagram. Follow us in Instagram for notes. Musculocutaneous nerve. See, this is important for 5 marks question. Very important for 5 marks question, frequently asked question. Next, coming to the point, see now coming to the features of this musculocutaneous nerve. It is the main nerve of front of arm. See, front of arm, this is the humerus of upper limb and it is the front of arm, and from below the elbow it is called forearm. Above the elbow, that means at the region of humerus, is called arm. So today we are going to study about this front of arm, that means this part, about the humerus part. Okay, next, it is the main nerve of front of arm. It is the main nerve of the front of arm. It's next, it continues below elbow as lateral cutaneous nerve. See, it is the branch of lateral. See, I will tell clearly. It is the branch of brachial flux, that is lateral cord. So we have studied that in the branches of brachial fluxes there is lateral cord, medial cord and posterior cord, and in the medial cord, in the lateral cord, the musculocutaneous arises from that lateral cord. Musculocutaneous nerve arises from the lateral cord, and from it extends from the lateral cord from here to the lateral side of the humerus up to here, and it continues as lateral cutaneous nerve of forearm. From the elbow, that means from the forearm, it continues as lateral cutaneous nerve. It is the third part of axillary artery. Next, coming to the root values, see its root values is C5 to C7. We have studied about the root values of this while studying in the brachial flexus. See, the lateral cord of brachial flexus, the root value of lateral cord of brachial flexus is between C5 to C7. Next, coming to the origin, course and termination of this nerve. See, I already told about the origin and the course of this. See, the origin, it extends from the brachial flux and continues as lateral cutaneous nerve. Okay, it accompanies with the third part of axillary artery. Next, it then enters the front of arm, from the brachial flexus it enters the forearm. See, where it enters the forearm means at the point of coracobrachialis muscle. At coracobrachialis muscle. Here is the coracobrachialis muscle. It enters through coracobrachialis muscle by piercing the coracobrachialis muscle into the forearm. Next, it runs downwards and laterally. See, laterally it comes towards the lateral side, and it is the head of humerus, and it is towards medial side. It comes to the lateral side, where it is coming to the lateral side in between the two heads of biceps brachii. That is, here is the long head of biceps brachii and here is the short head of biceps brachii. It enters in between the long head and short head of biceps brachii, like this. It enters between the long head and short head of biceps brachii. Next, it terminates by continuing as lateral cutaneous nerve. This is all about the origin, and here is the course. Course means that piercing the coracobrachialis and two heads of biceps brachii, and at the termination point is continuous as lateral cutaneous nerve. Now coming to the relations of the musculocutaneous nerve. See, it has 4 relations. The mnemonic of that relations is CAPS. C-A-P-S. CAPS. Okay. Now coming to the lateral relations. So here is the lateral relationship, and at the lateral side we can see the coracobrachialis muscle. We can see at lateral side we can see coracobrachialis muscle. That is for C. And next, coming to the medial side, medial relation. It has axillary artery at the medial side and lateral root of median nerve. It has axillary artery as well as lateral root of median nerve, and here is the lateral root of median nerve like this. This is the lateral and medial, A for axillary artery and long and a lateral root of median nerve. Next, coming to the anterior relation. Anteriorly it contains pectoralis major. At the anterior side it is occupied by pectoralis major muscle like this. Pectoralis major muscle like this. So pectoralis major, P for pectoralis major. And now coming to the posterior relation. At posterior relation it has subscapularis muscle. Subscapularis muscle. At the posterior region we can see subscapularis muscle like this. Subscapulary muscle. So as for subscapularis, I repeat again, coracobrachialis, A for axillary artery and long head and short head of median nerve. Lateral root of median nerve. P for pectoralis major, S for subscapularis muscle. This is about the relations of that median musculocutaneous nerve. And now coming to the branches and distribution of musculocutaneous nerve. See, we have 4 branches of musculocutaneous nerve. 4 branches. In the 4 branches, we have the mnemonic of here. See, the mnemonic is Mr. Cool. Say, Mr. Cool, attend to the camp. Mr. Cool, attend to the camp. That is M for muscular branch and C for cutaneous branch, and this A for articular branch, and again C for communicating branch. Okay, next coming to the explanation of these branches. First, muscular branch. Muscular branch, that means these musculocutaneous nerve supplies to the 3 muscles, that is biceps brachii, long head and short head of biceps brachii, brachialis and coracobrachialis. Long head and short head of biceps brachii, brachialis, coracobrachialis. This is the mnemonic of muscular branches, BBC channel, BBC. Okay, next coming to the cutaneous branch. Now coming to the cutaneous branch, it supplies to the skin of lateral side of forearm from elbow to the wrist, including ball of thumb. See, it supplies to the skin of forearm. It supplies to the entire skin, throughout the skin of forearm from starting from the elbow joint to the wrist joint and up to the thumb. Wrist joint up to thumb. Okay, it supplies to the skin of forearm up to from elbow joint to the wrist joint up to the thumb. Next, this is cutaneous branch. And now coming to the articular branch. Articular branch, it helps in the articulation of elbow joint and its branches to the brachialis. See, elbow joint through its branches to the brachialis. From brachialis muscle branches to the elbow joint and then to the shoulder joint through a separate branch which enters the humerus along with its nutrient artery. It supplies to the elbow joint as well as shoulder joint. And next, coming to the communicating branch. See, these musculocutaneous nerve through lateral cutaneous nerve of forearm, it communicates with, see, this musculocutaneous nerve through this lateral cutaneous nerve, it supplies to the, that means it communicates with the neighboring nerves. The neighboring nerves are superficial. See, the neighboring nerves are superficial branch of radial nerve. Next, posterior cutaneous nerve of forearm. And at last, palmar cutaneous branch of median nerve. So here I repeat again, it supplies to the superficial branch of radial nerve, posterior cutaneous nerve of forearm and palmar cutaneous nerve of median nerve. This is all about the branches of this brachial artery, branches and distribution of brachial artery. This is for today class, and we will meet again tomorrow. Thank you all.